Good afternoon. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, and streaming on Facebook. I'd like to thank John Pawsey and his team at TV3 in Connersville for also airing the show. And just a reminder to our audience that if you have a question, you can do that at the WCTV Facebook page and also on Twitter using the handle at WCTV Info. I'm Jason Troutwine, Vice Chancellor for External Affairs at Indiana University East, and it's my pleasure to be with you here this afternoon and filling in for my friend and colleague Eric Marsh, who couldn't join us this afternoon. I'm joined in studio today by Dr. Thomas Huth, the Vice President of Medical Affairs at Reed Health, and also with Dr. David Jetmore, the Wayne County Health Officer. Christine Stinson, the Executive Director of the Wayne County Health Department, will be joining us shortly on Zoom. But let's start our program first. We had a busy day the last couple of days, actually, and yesterday. And so, Dr. Jetmore, can you maybe fill us in about what's going on in your world right now?
Yeah, I'm always amazed at how much happens just in the weekly intervals of the show. A lot has happened. The coronavirus positivity rate in the county has gone up markedly, as it has in the entire state of Indiana. I think one of the big changes is the fact that we've gone up a stage on the Indiana County COVID map. We were at level yellow, and now we're up another stage to orange, the worst being red. So we're right below the worst tier. Because of that, the health department, along with Christine Stinson, met with Ken Paust, the mayor, and community leaders, because we need to respond to this increased level of infection in our citizenry. And because of that, the mayor and the commissioners have decided to limit public gatherings to 75 people or less. In addition to that, we've made recommendations to the school that in sporting events, only athletes who are actually going to be taking the field play. There won't be any band or any cheerleading, and the only people attending will be basically the parents of the student athletes. So basically, we had a Board of Health meeting which was dealing with these same matters, and then we had a press conference yesterday which basically let the public know what decisions had been made. I think it's important to emphasize that what we want to do as public health officials is not go back to lockdown like we had before back in the spring. We've had a lot of businesses that have had very hard struggles getting through this lockdown, this early mandate that the governor imposed, and they're struggling right now. And many of them might not survive if we went back to the mandates we originally had. But what we want to do is we want to slow down the spread of this virus, and we measure this by positivity rates. When groups of people are tested, we have a positivity rate. There's two of them. One for that includes everyone, people that are getting this test day in and day out, and then it also includes unique individuals. For the state of Indiana, it wavers around 7 or 8%. We'd like it to be below 5. In the county, it's been around 8%. But for unique individuals, that means individuals that haven't had the test before. They're getting it for the very first time. This has at times been 15 and 16%, which is very high. To kind of give you two ends of the spectrum, in New York City, the positivity rate now is 1%. In South Dakota, where the virus is raging, it's 35%. That means 35 out of 100 people that come in to be tested have COVID. The one thing we know about the spread of this disease, it's spread from people gathering together close to one another in large groups without masks. So what I would like to see happen is for us to wear masks, socially distance, and not hole up in our kitchens, but to go out, observe these parameters, go to your restaurant, go to your favorite restaurant. Those people are struggling. They need your business. Go to the movies, go to the store and shop, but keep those parameters. And if you're not able to do that, then leave. But our goal is to tamp down this level of infection so that we do not have to go back to where we were in the spring.
Yeah, thank you, Dr. Jetmore. Yesterday's press conference, I think it really, it brought things back forward, right? And how serious everything is right now. Dr. Huth, I know things are serious at the hospital too, and you're part of this conversation. So what's your week been like?
Well, it's been as interesting a week as Dr. Jetmore's. I haven't been to all of the meetings, but I did attend yesterday's press conference. And I would say at Reed, we've certainly seen an increase in numbers, and we've brought some graphs again today like we normally do, and we can review those when the time is right. We would not like to see it get worse. I think the thing is, with COVID-19, it's one thing to have, a lot of people in the community get it, but it's another thing to look at the breakdown of who is getting it. And we're seeing a much higher proportion now of cases amongst people 70 and older. And unfortunately, that's the age group with the highest risk of severe disease and poor outcomes, particularly death. And we made that point at the press conference yesterday. I sometimes make this analogy. If the COVID fairy appeared to us today, right here, and said, you get the next 100 cases of, the bad news is you get the next 100 cases of COVID-19. The good news is you can pick what age they should be. Now, some people in the community said, well, make them all 90 years old because, they won't be around long anyway. I think that's exactly the flip side of what the thinking should be. I would say make them all 10 years old. Now, that might give some families, moms, pitter-patters, possibly, but the reality is the risk of severe outcomes in a 10-year-old is very, very low, about the same risk as they have with getting a case of influenza. And, the case fatality rate in ages 10 to 19, is 0.02%, and that's just a little bit above what it is for influenza. And for slightly older age groups, it's a little bit more, but not much. So, if we made them all 10 years old, if all our cases were 10 years old, we'd not worry so much because they're likely to get through it having minimal or few symptoms, and most of them get over, almost all of them, 99% plus get over it just fine with no discernible sequela that we can discern particularly. But when when 20-some percent are ages 70 and above, it's a whole different story. We've got a case fatality rate in those age groups that average around 15%. And every day I'm looking at the new cases that Christine and Dr. Jetmore share with me, and I'm doing calculations in my head. Okay, how many deaths can we expect from this? And right now we're sitting at, I'm estimating we should have somewhere between 20 and 24 for this month, October only. Now, going into October, we had 16 for all of the pandemic to October the 1st. So, we are concerned about COVID-19 because of the possibility of these severe outcomes and people who are vulnerable, and that's why we get exercised about it. So I think what everybody needs to do is recognize that, even if you're a young, healthy person who's not likely to have significant disease or a severe outcome, the reality is we all have people in our lives who are at risk from this. And I could potentially expose them. If I am exposed and I shed asymptomatically or have minimal symptoms, I just have no way of knowing or being able to control whether I'm exposing other people unless I don't get it to begin with. So we have to make that chain of associations to see what our responsibility is to each other, and particularly to all the people that we love who are at high risk.
Thank you, Dr. Huth. I had a chance to read through the Palladium item article yesterday, and I was glad to see your quote. I think it alluded to the fact that you reject the type of thinking that basically the people in our nursing homes are expendable. And the fact that I saw Amanda Marquis from the Leland also talking about how unfair it is for some of these folks who, they've survived cancer, they've survived other illnesses, and to go out, and I think she put it, go out with COVID. Yeah. It's just not the way it should happen. Not when we can avoid it by taking precautions and being responsible.
Absolutely, and it's just not fair to them, no matter what their condition, no matter how, whatever longevity they have left. I think what I said yesterday was, I don't know what anybody's going to die of, and I don't know when, but nobody deserves to die now of COVID-19. And it's easily preventable. We don't have a vaccine. That would definitely help, but we know what to do to prevent the transmission. Many people are still skeptical about mask wearing and distancing and so forth. They say, well, that doesn't help. And it obviously doesn't help, according to some people. And I've heard people use the example of Dr. Box, who is the state health commissioner. She is actually off right now, having come down with COVID-19. And they're very certain that she acquired it through her grandson, who got it at his preschool. And I heard her say on the governor's press conference the other day that, anybody who thinks masks don't work, I beg you to reconsider. She said, I have been in meetings with other people. I've been in meetings with the governor, long meetings with the governor and staff at the health department, but none of those people are positive. And that's because they are very stringent on their distancing and masking and doing things remotely and so forth. Yet in her own bubble, the only place where she relaxes all that is in her bubble, and her grandson was in that bubble. So we can't take anything for granted, and I'm not saying don't visit your grandchildren, but I think we all have to realize that this is a sneaky virus that is, in my mind, is optimally adapted to get at the people who are at high risk, because the people who are at low risk hardly have symptoms and don't even think they're sick, but they carry it around as a reservoir, put it like that. And if those people, if I'm one of those people and I go with the attitude, this is all a bunch of hullabaloo, and I'm not wearing any masks, I don't need it, and only scared people wear masks, well, you're just willingly serving as a part of that reservoir in that case. So I like to add, we talk about masking, distancing, hand hygiene. I always add a fourth, which is don't go places, in order to protect myself, don't go places where other people are not taking this seriously. And, when I go into somewhere where, like a retail establishment where other people aren't wearing a mask, not distancing, not taking it seriously, I turn around and leave. And, I feel like that's what I need to do, because I work with, in my clinical work, I work with vulnerable elderly, and it would kill me if I accidentally made one of them sick. So I'm just not going to go there.
Sure. I think all those are great points. Now is not the time to let our guard down and to also be, mindful of the bubble that we're around. I think let's bring Christine Stinson into the conversation, the Executive Director for the Wayne County Health Department. Hi, Christine. How are you?
Yeah.
Good. Thank you for joining us today. I know you were a part of yesterday's conversation as well, and I know you've had a chance to listen in on Dr. Jetmore and Dr. Huth's thoughts. And so anything you'd like to share with us regarding yesterday, or caution that you might want to share with some of our viewers on how they can protect themselves and what they should be thinking right now?
Yeah. So yesterday was another really groundbreaking day. 55 cases were reported in Wayne County alone in one day yesterday. looked at our numbers today. We're on task to bring in, scores more today alone. So wear a mask, socially distance, avoid large gatherings. If you're sick, stay home. I get being fatigued. I do. Trust me, if there's anybody in this world right now that understands the fatigue of COVID-19, it's public health. We have been battling this hard, doing case investigation. And I challenge anyone to do case investigation and listen to just one person that's had cases of COVID and how they struggled. I'll tell you a story today. I'm raw right now, by the way. I'm just raw with emotion and frustration. But a woman called today. She had got a negative test earlier in the week, and she's just not getting any better. And her boss was wanting her to come back to work. And as I talked to her, she could barely breathe. She couldn't get through sentences. And I asked her, I said, well, why don't you go to the doctor? And she's like, well, my test came back negative. The health department now has rapid testing. So I said, why don't you come to my testing site and let's do another rapid test. It's been a few days. Let's get another test on you. I said, I'm really concerned. I wish that you would go to the doctor. But she didn't want to go to the doctor. I went ahead and scheduled her for a rapid test so we could see if we could get a rapid response on that. She didn't show up. So after about an hour and a half, I called her, and on her way to the hospital, she could not breathe at all and went to the ER. So that's how quickly, you can go from should I go to the doctor or not to getting yourself to the ER. It's hard to listen to people that have COVID, as she can't get air in. It's just frustrating. It's an actual virus. Some people do have very minimal symptoms to this, but some people have extraordinary. And no one deserves to die gasping for breath. And that's how they're passing away from this. So.
Thank you, Christine. I appreciate your passion, and you're right. First of all, this is avoidable if in many cases, and I know that's what the three of you are here to talk about today. And I also, just as an outsider, I work in higher education, and I know how stressful it's been for all of us. I can't imagine what it's been like for the three of you, and for all of the people who are out there on the front lines. And I've had a chance to see Dr. Jetmore and Dr. Huth a couple of times, and hear a little bit about what you've been working on. And I know I share the sentiment of a lot of other people saying thank you. Thank you for the work that you all are doing. Thank you for the work that the people at Reed Health, Wayne County Health Department, other providers in our community, because it's obviously it's everything that we're talking about. And you mentioned COVID fatigue. That's something that I wanted to talk about a little bit, because I hear a lot about COVID fatigue. And I have my own opinions about it. I look at the numbers that were early in the year, and I see how we surpassed those, and we seem to have taken it. We were taking it maybe a little bit more seriously early, and now we're all fatigued, and that's our excuse not to take it quite as seriously now. So, Dr. Jetmore, I'll kind of come back to you. What's your thought about COVID fatigue, and what would you tell people who might be saying that's my reason for not doing this right now?
Well, I think a lot of things go into that. I think one of the things is if you haven't gotten COVID, you've reflected back on all these interactions, and you survived that and didn't get infected, so you began to, it makes you think, well, I guess I'm not going to get this. I think that's one factor. Another factor is you feel like you've paid your dues. You think, I've been wearing a mask for 3 months, 4 months, 5 months. I've paid my dues, but the virus doesn't operate with those rules. It doesn't care how long you've worn a mask or what kind of rationale you might make up for, giving up or not being as careful as you were before. I think in the beginning we were all frightened, and that made us wear a mask, and we were all scrubbing surfaces and washing our hands 20 times a day, and a lot of that fear has subsided. And then some people just have been aggressively in the other direction. I mean, that's not part of COVID fatigue. That's just being a COVID scofflaw, I guess. I mean, they feel like it's much ado about nothing. It's a big media hype. It's not much worse than the flu, and so on and so forth. But I think that's what the fatigue amounts to. And I think that's true of any. It's a sacrifice to wear a mask. Some of the things, you know, it's funny, we do without thinking about it because society expects us to. I get up every day and put my pants on before I go out the door. And I've gotten into that habit. Society assumes that I'll continue to follow that routine.
I think we all assume you might, just saying. So,
but it is a pain to wear a mask. I mean, I did 40 years of surgery, and I mean, as the nurses and doctors headed, when the bandage was put on the wound, the first thing we did was we reached up and ripped our face mask off. The room did that as a whole because we didn't want to wear a mask. But this is something we're doing because, we're members of the same society. We're breathing the same atmosphere. When I breathe out, it's going into air that you're breathing. I wear a mask for the same reason. I'm not going to throw sewage into your drinking water. We do this because we're social animals who live together in groups and want to keep on living. But it is a sacrifice. It's a minimal sacrifice, but no one wants to wear a mask on their face. But I think that's basically what this fatigue is.
And there might be some other things about the pandemic that have kind of altered people's perceptions of things. That, in my mind, one thing that's kind of a double-edged sword is the fact that over time, sort of the severity of illness has actually decreased somewhat with the virus. And early on, there weren't as many cases, but there were a lot more severe ones. Now, there are a lot more cases and proportionately fewer severe ones, but there are severe ones significantly. I mean, just to give a specific example, I look at calculate case fatality rates all the time. That's not something that the state publishes, but it is easily calculable from the information that the state puts on its website. And I've noticed that early on, in the 80-plus age group, the case fatality rate was about 33% in the kind of the first 1 or 2 months of the pandemic. Now it's like 23%, just under 23% in the latest period, and there were fewer hospitalizations as a proportion of the total cases. There are more hospitalizations. You see that line going up, but if we had the same rate of hospitalization that we had in the spring, the hospitalizations would be much higher. So and I think a lot of people are aware of this effect that for whatever reason, sort of the severity, it seems to be a little bit less compared to what it was in the spring. Now, we're glad of that. That's the positive side of the sword. The negative side of the sword is people are aware of it. And so they're starting to think, well, maybe it really is no big deal. And, but I think that's a mistake. It is still a significant problem because we do have 23% case fatality rate in the 80-plus age group. We do have about 10% case fatality rate in 70 to 79. So these are significant numbers. Those are high numbers as far as, as we consider in medicine. And, I've tried to think of many analogies to kind of keep people engaged. And I like your analogy of, hey, it's kind of a hassle. Wouldn't it be nice to just get up and walk out the door without getting dressed? Not do anything from your bed to going out the door.
It's such a hassle. You got to put your legs down the pant legs, and then you got to crawl into the shirt.
And then maybe you don't like the way it looks. You got to take it all off and start over. There are all kinds of problems and hassles associated with that. I shave most days. Over here and over here. I did this morning. but it's kind of a pain, and it's just that much more time I got to spend in front of the mirror. So I don't do it every day. Now, if I would do it every day, if by not doing that I was putting myself at medical risk, but. So there are many things that when, you get up on a Saturday and it's like, oh, I'm not going to bother shaving today. I feel free not doing that. Heck, I don't even have to take a shower if I don't want to. My wife appreciates it when I do. But there are a lot of things I could dispense with at certain times, and it's kind of freeing to do that. So I totally get it. In fact, people have said to me, I've been just so tired of worried about it all the time, and we decided to go to Oktoberfest and just dispense with the mask, and gosh, that was so freeing, I was told on one occasion. But it resulted in a problem. And, so I understand that. We just have to kind of figure out how to kind of stay engaged, and that is to kind of connect the dots to the possible consequences and maybe just look at masks as that's the way it's going to be for the indefinite future. I wish I could say that having a vaccine is going to change that, but I'm not confident of that for a lot of reasons we can get into. I've written an article for the Chamber of Commerce magazine that will be coming out next month, or maybe this month yet. It's next month's edition of it, kind of discussing the fact that we shouldn't look to vaccine to changing the game entirely. Maybe it will, and it'd be nice if it does, but we shouldn't assume that, and there are many reasons to expect it won't. It's going to boil down to if you're playing baseball, there are certain basic things you've got to do. Not everybody's going to get up and hit home runs. Not everybody's going to get walked all around the bases. There's certain fundamentals of playing the game that everybody has to do. It's another analogy I've been thinking of. And if you're going to be successful at the game, as much as it's a pain to remember and do all those fundamentals, that's what you have to do to be successful at it. So I think masking, hygiene, distancing just kind of has to become part of our fundamental approach to life for the foreseeable future.
Right, just kind of embed it in our daily lives and accept it for the time being until it's not part of our daily lives. And to be honest, hand washing and all those other things, they should be anyway. Mm-hmm. Those should have been long before COVID ever happened. We referenced earlier the press conference took place yesterday. Just for our viewers, you can find that press conference, that full press conference, on the WCTV Facebook webpage. So if you want to go to WCTV's Facebook page, you can view that press conference. And I'd like to bring Christine back into the conversation a little bit to find out. We're talking about COVID fatigue, talking about other things. What kind of feedback have you received, if any, from yesterday's press conference? Have you had folks who have reached out saying thank you for helping us, or have you heard from the other side of why are you doing this? What's been the reaction that you've heard so far?
Yeah, not too much. Had a email challenging the effectiveness of masks and putting the shame on me for requiring healthy people to wear masks. I reminded them that was a mandate from the governor, that as powerful as I like to think I am, I'm not all that powerful. That came down from the governor. But we definitely support the masking mandate and want everyone to wear masks. And then some people just really kind of wanting to know, well, how are you calculating some of those figures that Dr. Who had put out there? So, and all of the information that we talk about is on the state website. It's very transparent. Cases are put out there, positivity rates are put out there, death rates are put out there for each and every county. I encourage people to watch those dashboards with ISDH. And you can simply go to isdh.in.gov and click on the tab for coronavirus, and it will take you to the dashboard. You can watch it daily. It updates every day at noon. And then every Wednesday at noon is when the county metrics are calculated and put out. And that's when we'll know publicly, the state will announce what caller we are, or what level we're at. I do want to kind of talk about schools a little bit and how these cases affect schools and why it's not only important that we keep our positivity rate down and our case numbers down for businesses, for the elderly, for our long-term care residents, but it's also we need to keep our schools open. And it becomes a struggle and a heavy burden on our schools when we have these high transmission rates in our county. And our schools right now are starting to buckle underneath that weight of all of these cases. They have staff members out, they have bus drivers out, they have mechanics out, they have students out, not only because they're positive, but students because they're close contacts of other events. We really feel like most of the cases that we case investigate, the transmission isn't happening inside of the school. It's other activities outside of the school that are causing the positivity rate, but it affects the school. It affects the students, and it affects the ability for the schools to function. So what other reason do you want to have a mask? To wear a mask, right? Tell me anything. If you love dogs, I can give you a reason why to wear a mask, why that helps our dog population. It's good to wear a mask during a worldwide pandemic. It just is a good thing to do. And gosh darn it, feels good. I like wearing the mask.
Christine, just one question. This actually came in from one of our viewers. If you're seeing an increase in the schools or more from, let's say, the extended care facilities, where are we seeing more of the increases come from? Is it more school related? Is it more extended care? Is it someplace else where a lot of the increase in positive tests are coming from?
Okay, for 2 weeks, we had some outbreaks in our long-term care facilities, and we saw a big amount of them. Maybe a fourth of our cases came from long-term care facilities, and the majority of our deaths have come from residents of long-term care facilities. Of our 31 deaths that we have right now, 22 of those are long-term care facility residents, and 9 are community members. And that's not to discount, we don't have to worry about it. They were long-term care residents. This week and moving forward, it's everywhere. It is all over the board. We're bouncing everywhere. And it's hard for a case investigator to have that aha moment. That's where that happened. I know it was when Jim was sitting next to Sally at the wedding on the 26th. So we see clusters in businesses. We've seen clusters in families, definitely. When one person gets it in the household, it's like a domino effect of the rest of the household. That's why we advise people to, when you're in isolation in your household, to isolate away from each other if possible. It's often hard to do when you're a parent of a 2-year-old. And I totally understand that. But if there's a way to isolate away from the other family members and we can stop it from running rampant in the family, we like to give that advice in family members. We've seen outbreaks surrounding funerals, surrounding weddings, in office buildings, in events. There's been where we've calculated or have been able to trace it back to different events that have happened in Wayne County.
Sure, thank you. You talked about contact tracing. I imagine that is a really difficult task. I know, obviously, here at IU East, we and through the IU system participate in that as well. And it's a difficult task. It's calling upon people to remember where they've been and who they've talked to and who they've been around. But it's really important, obviously, to try to find the root of where some things are happening. I do have another question, just real quick, as a follow-up. You mentioned the schools, and one of our viewers had a question about what will it take, or what would it take for the schools to close? Is that getting to red? Is that meaning that everything's then moved to a virtual environment? And then, if that is the case, is turning to red simply a numbers thing, or is that a decision that you all will make on your own?
So the levels are actually calculated by metrics that are put out there. So it's your positivity rate and your
Cases per 100,000.
100,000. Thank you, Dr. Jetmore. Sorry. So you get scored on those two metrics. So our positivity rate was when they calculated it at a 7, and that gave us a ranking of 1. And our cases per 100,000 was 283, and that put us at a 3. So you add those two together and then divide it by the metrics, which are the two metrics. So it was 4 divided by 2 gave us a score of 2, and that puts us in the orange category. So if either one of our metrics bump up, if our positivity rate goes up to a 3 also, that definitely will put us in the red category. And so we don't decide at the local level what color our county is. The state assigns that to us. And then they give guidelines of what you should be doing. And virtual learning is one of those things that they advise when a county's in red that you do. And it's always an advisement from the state. It's not a mandate. We don't have to wait till we're red to do that. I work closely with the schools. And if at any point my school feels like they're buckling and it's just too much for them, I support them in making the decision to themselves go ahead and do virtual learning, maybe for a couple of weeks, see if we can slow this down inside that district. Because, there's different times that, maybe Richmond schools could handle, having 5 students and 3 staff members and 4 support staff. But one of the other smaller schools would find that a burden. That's not for me to decide when it's a burden to them. At some point, the county will look at rates and say, we need to kind of maybe go virtual for a while and see if we can slow the spread. So I leave a lot of that to the schools to make their own determinations and support them in that. If they feel like they need to close for a couple of weeks to do virtual learning, I support that.
Well, thank you, Christine. Appreciate your response there, and also appreciate your time today. So I think you're going to take off a little bit, and then I'm going to turn this back to Dr. Jetmore. So thank you, and again, thank you for the way that you're serving our county. We really appreciate your service.
Don't forget we have the testing site at the Elder Beerman building,
Yes.
and there's also the testing in Cambridge City.
Absolutely, and also the rapid testing at the Wayne County Health Department, correct?
Rapid testing.
And do they just sign up? How do they do that?
But you can always contact us and see if you qualify to have one of the rapid tests at our site.
Wonderful. All right, thank you again for your time today. Appreciate it. Good to see you. Dr. Jetmore, I wanted to come back to you. We were talking a little bit about, the possibility of going red for the county. If your crystal ball, what's it say? Is that where we're headed?
I hope not. This is posted every Wednesday. The state calculates the metrics and you're assigned a color. And I didn't want to go to orange. I liked the lowest level blue. But if we go to red, we're going to have to mandate a lot more strict orders. It's probably going to affect restaurants, it's going to affect bars, it's going to affect any event that involves a gathering of people, movie theaters, theaters in general. So I'm hoping that it won't. And the only thing that will keep it from doing that is if people follow these simple guidelines of social distancing and masking. If they don't, then we'll reach red, and when we do, then we'll have to mandate this thing. The paradox of public health is the fact that it's easy to get people to do something when they can see caskets being loaded onto refrigerated trucks because there's no other place to store them. We all saw that image in New York. Then you can get people to wear masks. But if people aren't seeing, people are not over at the hospital watching people on ventilators in ICU, they may know of a couple people that had COVID. They weren't very sick. So what's the big deal? The way to stop this is now, when we haven't gotten to that level. When you get to that level, it's almost too late. And Dr. Huth always alludes to this. You know, these metrics reflect what happened 2 weeks ago. So we're not, if we really double down now, we're not going to see the effect in decreased positivity, decreased death rate, decreased hospital admissions for a couple weeks. There's a couple week lag time. So the short answer to your question is I hope that that doesn't happen, but I'm fearful that it might.
Yeah, I think we all are. Just a reminder to our viewers that you're watching Ask the Doctors on WGTV Channel 11 and also WCTV Channel 21 and on our Facebook feed. I know Dr. Huth comes to this program every week with some slides, and I know you've already referenced those slides a couple of times. And I'm wondering if we can bring those up, and maybe you can walk us through them just a little bit. And I actually have a question. Now, you talked a little bit about some of the, maybe when you get to the slide, the number of positive cases with the population over 70, but it also looks like maybe there's a few more in the 50 age group as well. So I'm curious your thoughts about that.
Sure.
Can we do that one first, the one with the age groups, if we can?
Sure, there's the age group slide, and this is completely updated, so it looks a little bit different than the one that was shown yesterday at the press conference. I update it as frequently as I get data from Christine's office, and I got a new set of data this morning to add to it. And so just a basic tour here. It seems busy, but it's actually pretty simple. We have the age groups, and each cluster of bars within an age group are the percentage of cases in that age group over time. And so basically it's essentially bi-monthly. The last bar on the right of each group, the darkest bar, is October so far. And I've always pointed to the last two sets, the 70 to 79, 880 plus. You can see that we've, as of through yesterday's data, we have in Wayne County 11% each in those two upper age categories. But there are changes in other age groups, as you've noted, Jason. And prior to this past week, we were referring to the fact that the 10 to 19 and 20 to 29 had been up, which they were, but you can see that they're all down now. Just as a percentage, there are more cases, but as a percentage, they are lower. And you can see also that there has been an increase in the 50 to 59. I'm not sure I know what explains that, but that's just a function of who's getting exposed. And and maybe it's that when we see an increase in the highest age categories, well, who's taking care of them? And maybe that's often family members, or if they're in a long-term care facility, there'll be some staff who are in the middle-aged age ranges, and they may be also being exposed, or they're exposing the higher age group one, or the highers are exposing the lower. Who knows what the vector of transmission is, but I think it's possible that those kind of float together because of who cares for the highest age group people. And so I think that explains that. But when you sit down and do the math, we've got 11% each in the highest age group. And on the total of Wayne County lab positive cases through yesterday, at least the way I count, is about 544 total cases. And you can just do simple mathematical calculations to come up with, what's the risk of death from those age groups. And like I say, I'm at probably for the month we should be at a total of between 20 and 24. Hopefully less. Pray that it won't be more, but probably in that range. And that's just simply the 20 is what would calculate on what we've had so far in terms of active cases in those age groups. 24 would be if you look at how we've accumulated the deaths so far this month and then project them out the rest of the month. So that's my range that I'm using. It's semi-scientific anyway, and but it's more commonsensical and hopefully we'll be less than that. But we're up to 17, I think, with a new death from yesterday. And so I don't think we're going to have, unfortunately, not going to have much trouble getting to the 20 at least. When you look at the other slides, you were just showing one there, Ryan. These are the lab positives for Wayne County, updated through yesterday, and it was 182 cases for this week so far. I color that bar a little differently because that's tentative and it only has a partial week in it. But if you project out from what we've had so far, 182 cases for essentially 5 days of data, with 2 days left to go, that projects out to possibility of reaching in a neighborhood of 230, 240 cases total for the week. Hopefully that won't be the case. We'll just have to see. And there should be one other slide there, Ryan, on read cases, if you can show that. And this is a version that I've shown different versions just to kind of bring some variety, but this is kind of the whole pandemic so far. Average case volumes at read in 3 different categories. The blue bar is total patients in isolation beds, whether they have tested positive or not. Some of them may have tested negative, but there's still a suspicion, or they maybe have a test pending. There are a variety of reasons why people who are not known to be positive will be in isolation beds. The red bar is the known definite lab positives, and the lower gray or green bar is the cases in the ICU that are on ventilators. And and so that's the last set of bars there is for the week ending tomorrow, and so that's also a partial week. But on average this week we've had 46 patients in isolation areas, 28 known positives, an average of 1 a day on a ventilator. And so there's kind of good news and bad news in this. The bad news is it's been increasing, that the total cases have been increasing over the last 3 weeks, and we're back up to about where we were in terms of total isolation bed use, up where we were at about the 3rd week of May. And we're at all-time highs on the known positives, well above actually. But the good news is not as many, we haven't had really a significant increase in the numbers on ventilators. And that's kind of an example of how I think there's been a slight sort of notch, or a notch down out of maybe, if we had a knob that had a bunch of notches on it, we'd be like 1 notch down in severity. It's not a nothing disease, but it's not as bad as it used to be. And but there could be other reasons for that too. But we're glad to see that we're not having so many cases needing ventilators. I guess what I would point out is that the numbers that we're having lately, they're manageable. We can handle them at rate, and we can handle more. There's no question about that. We've got the staff, we've got adequate beds, we've got adequate ventilators and supplies, adequate PPE. That's a little bit, is a significant improvement, let's say, from the spring when there were more challenges with PPE. That's not really an issue now. Sometimes there are little things that we have to pay attention to and work on in terms of PPE, but it's not. We're nothing like the type of crisis kind of thinking about PPE use that we were in the spring. And all that's good. We can handle these cases and we can handle more. Do we want to handle more? No, we don't want to handle more. Partly because that means those are actually sick people suffering. We don't want any more of that. We want less of it, not more. But even of more concern to members of the community, I think, is that we can think of the hospital as a box that has it's rigid, it has a certain size and shape and volume, and we can fit so much into that box. Now I can put more COVID into that box, but I've got to do less of something else. We are not at that point where we're on the verge of actively cutting back on some services, but that's the risk we'll run if these numbers continue up. And so that means somebody's not going to be able to get their hip replaced. Somebody's going to have to delay getting their heart disease their procedures taken care of. there might be problems with people getting their cancer treatments on time. You know, we don't want that cascade of events to happen. And I'm not saying they're going to happen. And we would do everything we can to avoid it impacting the most critical services. But some things, you know, something has to give at a certain point.
Sure. So just like everything else, you can only do so much, and you have to give something up to do something else.
Right.
And that's true in healthcare as well. And obviously, if we can keep those numbers down by, again, getting back to wearing masks, washing hands, we can try to avoid some of those numbers at the hospital so that those elective surgeries still can happen.
Exactly.
And they're not put off for elsewhere. I know we're running up against time here soon. We have about 7 or 8 minutes, I believe, and I would like to get to a question if we can. And I apologize to our viewers that we weren't able to get to very many questions this afternoon, but with yesterday's press conference, there was a lot to unpack with that conversation, and so we'll try to get to those next week, but we'll take one real quick now. So let's see. If you work in an office setting with multiple people and 2 test positive, should everyone in the office quarantine for 14 days? And Dr. Jetmore, I don't know if you want to maybe take that one for us. Is that the way that it should happen?
I'll take that question. You know, we ask people to quarantine if they've been a close contact, and that means within 6 feet of someone for 15 minutes or longer. And actually, I'll just add this little addendum. The CDC has changed the definition of what a close contact is, which is spending 15 minutes within 6 feet of somebody over a 24-hour period, which means if Tom's got COVID and I spend 2 minutes with him and then an hour later I spend 3 minutes, and that adds up to 15 minutes or longer, then that's considered a contact, and the contacts have to quarantine for 14 days. Now, if you're working in that office, you've got a desk on the far side of the office and you haven't been within 6 feet of the person, and you haven't spent that 15 minutes, then you're not considered a close contact. You don't have to quarantine. Now, there is this caveat, you know, if it's an office that, you know, has an air conditioning system or heating system that recirculates a lot of air. I mean, you may be, it may be prudent for you to limit your contact with other people, but you're not considered a close contact. You won't be asked to quarantine unless you are.
What I tell people is, you know, you don't need to quarantine unless you are specifically identified as a close contact. That includes people in offices. As long as people will cooperate with the contact tracing, which can be a problem, you know, we can get those people identified and they can be quarantined. On the other hand, what could happen is that an employer might decide, I've got a space that a lot of people work in and several people are positive. Out of an abundance of caution, I'm just going to send everybody home to create a little firewall and break. You know, and maybe that's 14 days, maybe it's not. I've heard places that sent everybody home from an office for just a few days, and then did a deep cleaning in the office in the interim. So there are a variety of possibilities. But I think from a public health perspective, I usually tell people it just depends on whether you are specifically identified as a close contact than you do what the health department tells you.
You know, you reminded me of something when you were talking, Tom. I've had this question many times. People have been told that they're a close contact, and then they say, well, I'm just going to go get tested, and then if that test is negative, then I don't have to quarantine. Well, that negative test is not a get out of jail, or in this case, get out of quarantine free card. You still have to quarantine. One of the things, those tests don't turn positive often until 5 to 7 to 8 days after you've been infected. They may, you know, there are false negatives on the test, so the prudent thing to do is to go ahead and quarantine, and you know, it's the most prudent and the best practice.
Yeah, it's simply a snapshot in time.
Yeah,
right?
exactly.
And it also Yeah, it doesn't mean it's not necessarily going to reflect what happened last night.
No.
Yeah.
And the tests have a significant percentage of false negatives. So in general, if the test says you're positive, you probably are. If it says you're negative, you may not be.
Yeah, yeah. We have about 3 minutes left. I'm going to turn it back to the two of you to any closing pleas, arguments, anything you may want to say to those who are listening. Dr. Huth, anything you'd like to share to kind of wrap us up?
I don't want to get too repetitious. Just maybe to lighten things up a little bit, there was a little bit of news this week about a scientific article that was published on the use, on the ability of mouthwashes to kill coronaviruses. And that's the way it was reported in the news. And I looked up the article in the Journal of Medical Virology. And actually, the more interesting aspect to that I noticed was that one of the things they tested was dilute solutions of baby shampoo as a nasal wash. And that eliminated non-COVID-19 coronaviruses as effectively as Listerine did. And I thought that was very interesting. Now, I don't know that that means everybody needs to go out and start nasal washing with baby shampoo.
I'm going to do it.
But, but it sounds like a pretty low-risk kind of thing, possibly. Very dilute, though.
You know, I have in that same vein, somebody pointed out to me an article. We had a lot of this discussion early in the pandemic, Tom. What's better, cloth mask, paper mask? Well, somebody said, well, you know, has there been any studies on cloth masks? Well, there were. There were tons of studies. They were all done in the 40s, 50s, before there were paper masks. They only had cloth masks. So they went back and looked at that data, and those masks worked very well. The best were 2 layers of cotton, but those cloth masks worked fine. So we've moved way beyond. We're just happy if people wear any kind of a mask. I mean, put some burlap over your face. It'll make me happy.
Well, I think that's the message of today. Make sure you wear a mask. Make sure you wash your hands. Make sure you physically distance, social distance, and try to make sure you're thinking about other people. So we're running out of time, but I would like to thank Dr. Huth, Dr. Jetmore for being here today. Thanks for letting me sit in. It was enjoyable. I had a good time.
Thanks for being
You did a fine job.
Well, thank you. Thank you. Hopefully I didn't let Eric down too much. So I'd like to remind our audience about some of the testing sites. Of course, you can go to the former Elder Beerman site for testing. You can also go to Cambridge City's site. And of course, we heard Christine Stinson, who I would like to thank for her participation today as well, talk about the rapid testing that you can get at the Wayne County Health Department and a few other providers here in town as well. But you want to make sure you contact those providers and make an appointment to do those things. So again, Elder Beerman, Cambridge City, the free testing. And again, thanks to everyone for joining us today. And thanks to our doctors for their time. And everyone stay healthy.